My name is Macy Goals, and I have been a nurse for a year and a half. I currently just moved to Baton Rouge from my hometown Reston and work at Baton Rouge General in the ICU. HIPAA is very important in the field of nursing because we deal with patients on a daily basis, and patients must always be protected. The Health Insurance Portability and Accountability Act of 1996, which is HIPAA, is a federal law that required the creation of national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. HIPAA rules govern healthcare providers to protect patient privacy. To maintain HIPAA compliance, there are costs related to software, electronics, training, and manpower. If a provider violates HIPAA guidelines, they are fined. Fines, along with other unexpected expenses, can cause a negative impact that may alter the services provided by the institution and the community's perception of said services. One way to prevent HIPAA violations in my workplace is to make sure to log out of the computer every time I get up to do whatever it may be. Go into the patient's room, go to the bathroom, eat, etc. All of my patient's information is on the computer, so if I'm not logged out, anybody can have access to the patient information and look up whatever they want to. The patient medical information is private, and not just anyone can have access to that. I can also make sure to place all paperwork on a patient in the correct bins or the shred bin. I feel like it is so easy to just throw things into the trash cans without thinking, but patient information must go into the locked bins. So often pharmacy, lab send things up with patient labels or information on it, and nurses just toss it away in the trash can without thinking about it. So I can make sure the paper with any type of patient identifier information gets tossed into the designated lock bins that are all around the unit. Both of these prevention techniques would prevent a violation because I'd be keeping information out of the public eye. Avoiding violations is important in the ICU because impermissible uses and disclosures of PHI and breaches of unsecured PHI can result in loss, fraud, and reputable damage. It also causes patients to lose trust in healthcare providers and workers. Patients want their health information secured. They don't want just some random person walking around the unit, whether it be janitor, lab, pharmacy, a family member, seeing any kind of information about themselves. Typically, when patients come to the hospital, it's for a reason that maybe they don't want other people to know. So it is very important to keep all patient identifiers information away so you don't violate HIPAA.